Addiction is your brain's chemical dependence on a substance. It's something that makes your brain think that you can't live unless you get that chemical one more time, regardless of consequences. Addiction comes in all shapes and sizes, and the targets of our addictions can range from drugs to sex to alcohol and everything in between. An addiction of particular concern in the US today is opioid addiction and the opioid abuse that stems from it. In recent years, the number of users has increased significantly for all kinds of opioids, including codeine, morphine, heroin, and the commonly prescribed drugs like hydrocodone, fentanyl, and oxycodone. The 2016 National Study on Drug Use and Health reported that an estimated 28.6 million Americans aged 12 and over used illicit drugs during the month prior to the study. This means that roughly 1 in 10 participate in some level of substance use, including addiction to prescription drugs. And the number of prescriptions written for these drugs is increasing too, with approximately 7 prescriptions written for every 10 people in the US. Pregnant women are no exception to these statistics because becoming pregnant doesn't magically rid you of your opioid addiction. However, it does present some additional issues because, as we know, the babies are affected by the opioid use too. One major complication of opioid addiction during pregnancy is seen after birth, and it's known as NAS, or neonatal abstinence syndrome. Infants who are affected with NAS suffer from withdrawal symptoms anywhere from 2 to 3 days up to 6 months after birth. Withdrawal symptoms include tremors, hyperactive reflexes, seizures, excessive high-pitched crying, irritability, sleep disturbances, increased sweating, temperature instability, and fever. NAS also has longer-lasting effects such as learning disorders throughout childhood and difficulty maintaining employment and healthy relationships in adulthood. Beyond the health complications, NAS can place a financial burden on the mother and the hospital. On average, NAS generates $316 million in medical care expenditures throughout the United States because of a lack of medical coverage and unstandardized treatment methods. Women are often blamed harshly for their struggles with opioid addiction, especially when it persists through pregnancy, facing all kinds of ridicule. In states like Florida, South Carolina, and Alabama, women are arrested, prosecuted, and have their infants taken away from them for seeking medical treatment while abusing opioids while pregnant. This causes women to delay seeking prenatal care until they regain sobriety or completely neglecting care for fear of legal repercussions. The AAP affirms that these kind of punitive measures are not in the best interest of the health of the mother or her baby. Instead of punishing women battling opioid addiction during pregnancy, let's offer them the same support we'd offer any person facing addiction. One such option would be drug replacement therapy to wean them away from the harsher addictive substances. Or increasing access to healthcare and health insurance coverage for mothers and for infants with NAS. And on the preventative side of things, let's increase our sex education and contraception education before prescribing opioids to prevent the occurrence of pregnancy while taking these medications. We must let mothers know that if they're struggling, they have resources, because our goal is to create a world in which mother and baby can be happy and healthy. Because we know that the best place for a healthy baby is in the loving arms of a healthy mother. If you or a loved one is struggling with addiction, don't hesitate to call the National Drug Helpline's 24/7 hotline at 1-888-633-3239 for help.